All right, everybody, this is take two on a Monday. Now we have audio, which some will probably think is a detriment, but it's that time on Monday, 4 o'clock, where we come together to remember that we're going to get through COVID-19, and we're going to do so together. We like to start these with good news because there is a lot of good news out there, and some big news from this weekend. The University of Kentucky's women's volleyball team won the 2020 Ncaa National Championship, bringing home the title to UK for the first time in the university's history. On behalf of the entire Commonwealth, I want to congratulate this entire team. You made us proud. Thanks for being a part of Team Kentucky. Thanks to the entire coaching staff. Congratulations to all of you on this historic win. Again, we are really, really proud of you. Second, good news started this weekend. On Friday, President Joe Biden granted my request for a major disaster declaration for the Commonwealth of Kentucky. This was for the historic flooding that occurred after we had already been hit by snow and sleet and ice. And what was really rare about this declaration is we didn't just get public assistance, and we got that for a lot of counties. That's damaged roads and government and other infrastructure. But we also got individual assistance for several counties, meaning Kentuckians who had damage to their property can apply for and ultimately get dollars to help pay for those repairs. The individual assistance was granted for the counties of Breathitt, Clay, Estill, Floyd, Johnson, Lee, Magoffin, Marion, and Powell, and we are going to be working to add additional counties to that through additional requests we will be making to the federal government. But I want to thank the president for his very quick action. This does not happen very often, so I believe that this is a very strong statement that the federal government cares about us in Kentucky, and it cares about Eastern Kentucky. You know, I visited just weeks ago to see the damage firsthand and know the needs are great. But this being one of the largest award for displaced individuals from damages to homes since May of 2010 means that this is a very big deal. Assistance for eligible survivors can include grants for temporary housing and home repairs and other serious disaster-related needs, such as medical and dental expenses. Long-term, low-interest disaster loans from the U.S. Small Business Administration may also be available to cover losses not fully compensated by insurance or other recoveries. Residents and business owners who sustain losses in designated counties can begin applying for assistance with FEMA, registering online at www.disasterassistance.gov or by calling 800-621-FEMA or 800-462-7585 for the hearing and speech impaired. The toll-free telephone numbers will operate 7 a.m. to 11 p.m. 7 days a week until further notice. Additional county designations may be made at a later date. We will be requesting them. It takes a lot of documentation, but we'll work with counties to try to make that happen. For further information, media can contact the FEMA News Desk at 202-646-3272. All right, in other good news, earlier today, I was happy to highlight some of history that is often overlooked. Every year, the run-up to the Kentucky Derby is a time of enormous pride for our Commonwealth. It is also a time to remember legends of the past as we forge the horse racing heroes of the future. In this atmosphere of reflection and anticipation, I was proud to recognize two men who are trailblazing in the horse racing industry, Greg Harbert and Ray Daniels. These two individuals recently founded the Ed Brown Society, an organization that provides mentorship to the next generation of African Americans in the horse racing industry. The organization's specific focus is giving college-aged ethnic minorities opportunities to take the reins of racetrack management and attorney work. The nonprofit Ed Brown Society is named after the legendary jockey Edward Dudley Brown. This Belmont Stakes winning jockey overcame his start as an enslaved person to become a storied trainer and jockey in Kentucky's horse racing industry. In the 1800s and early 1900s, the majority of jockeys were African Americans. One prominent example is legendary jockey Isaac Murphy, who won the Kentucky Derby 3 times. But despite centuries of contributions, after World War I, African Americans were pushed out of the sport. At that point, only hired as stable hands or support workers. Harbit and Daniels are taking on the task of restoring and recognizing our history and the contributions of African Americans in the horse racing industry. Additionally, they are embracing the call to lift as they climb by making opportunities for more African Americans in the forefront of this great sport. With those proud Kentuckians looking on, I was proud to sign a proclamation this week, a week when we think about horse racing so much, but that we can truly make a difference in making sure that horse racing is for everyone and the opportunities are available to everyone. So I signed the proclamation making April 25th through May 1st Ed Brown Society Week in the Commonwealth. All right, specifically on COVID. As we get excited about a light at the end of the tunnel in this pandemic, we must also make sure we never forget the loss and the sacrifices of so many Kentuckians during the last 14 months. That's why we've taken the time in each update to recognize each individual who has lost their lives to COVID. It's why we ring bells in this Capitol every day at 10 a.m. and why so many of you, me included, have lit our homes up green every day we've lost someone in this pandemic. We want to make sure that that loss and everyone's sacrifice is commemorated long after this pandemic. Last month, I announced plans to commission a COVID-19 memorial here on the state capitol grounds as we launch the Team Kentucky COVID-19 Memorial Fund to allow folks to contribute to this memorial. Today, we're taking the next steps towards creating the memorial. The Tourism, Arts, and Heritage Cabinet will be sending out a request for artists to apply with their qualifications so we can begin the process of selecting the artist who has the vision to make this COVID memorial a meaningful, permanent reality here on our Capitol grounds. Between today and May 30th, artists can submit a letter of interest, their resume, professional references, and examples of their past work. At that point, a minimum of 5 finalists will be selected who can then submit detailed proposals from which the final design will be selected. The current goal is to award a commission to the winning artist by August 1st and for the memorial to be complete by March 6th in time for the 2-year anniversary of the first case of COVID-19. Kentucky artists or artists with Kentucky ties are especially encouraged to apply. To apply, email applications to jessica.taylor@ky.gov. That's jessica.taylor@ky.gov. Thank you to all of those Kentuckians who have already donated to this memorial and anyone who wishes to add further support. Now, this is going to be one of the most memorable times of our lifetimes. It's going to be one of the most, it will be I hope that the deadliest time of our lifetimes, especially a 3-month period where when we look back, we lost so many Kentuckians. It's also going to be a time we remember for how we came together, for how we lived for each other. I hope it's a time that ushers in a new era of prosperity as we leave it, but also one where we come out of it better people with more compassion, understanding how connected we all are. This memorial is important. It's important for recognizing this period, but also reminding us who we were during it and who we need to be coming out of it. All right, update on vaccinations. Let's look at Table 1. As of today, 1,726,346 Kentuckians have gotten at least their first shot of hope. That gives us our magic number to hit the 2.5 million Kentuckian vaccine challenge, whereby we believe we can safely lift all capacity restrictions up to 1,000 people. Can we put that one up, Jim? Big number. Here we go. 733,654 Kentuckians away. It doesn't mean that we can't incrementally loosen some other restrictions until then. In fact, today we're going to announce a change based on both some recent data, but as well as a change we're able to make because of people that are vaccinated. Also, next week, we are going to be switching our reporting to make sure that it is consistent with the CDC, using the numbers that they post. We'll walk through that next week. Every other state is doing that, and that should account for Kentuckians that have been vaccinated in other states as well. Let's look at Table 2. That shows you that the number of Kentuckians getting vaccinated each week is slowing a bit. We are working on every effort we can. And when we get into demographics, there is a huge pool of Kentuckians, especially 20 to 49, that we need to be interested in getting vaccinated, from which we can reach this next goal. Right now, no matter where you are in Kentucky, you can get an appointment tomorrow. Please sign up and get your vaccine. Overall, when we look at the demographic numbers, we will see that 75% of Kentuckians 70 years and older are now vaccinated. That's good. We want to keep going, but that's good. 65% of Kentuckians 60 to 69 years old are vaccinated. That's good. Again, we want to keep going. But then we get to Kentuckians 50 to 59 years old, only 48%. 40 to 49 years old, only 39%. And then when we look at, when we get there later, 30 and the people in their 30s and 20s, the percentage there even lower. So why don't we move ahead into the demographics so we can hit that point, and we will start by age. Again, this graph is what you want to see, and that is those Kentuckians that are older having first chance at getting vaccinated, which they did. But as you know, this chart is starting to catch up, especially the 60 to 69 years old and 50 to 59, but we need to keep doing better. And as an example, 30 to 39-year-olds, only 34%. Vaccinated. 20 to 29 years old, only 25% vaccinated. And an area we're working on right now, we've seen some really good pop-up clinics in high schools. Good shout out to Central High School in Louisville and Fayette County Public Schools. Only 17% of Kentuckians age 16 to 19 vaccinated yet. So a lot of work to do there. As we look at gender, right now, again, women getting vaccinated much more than men in Kentucky, 55.6% of the total vaccinated women, 44.4% men. Race, we see, again, our numbers improving some, but not enough and not quickly enough. When we look at vaccinations, 84.08% white, 0.09% Native Hawaiian, 5.66% Black or African American, 1.62% Asian, 8.42% other. Again, the other higher than it should be. It's skewing the data some, but it's impossible to know in which area it is doing so. And then when we look at ethnicity, 97.5% non-Hispanic, 2.5% Hispanic, again, increasing as we continue efforts day in and day out to get this vaccine out in an equitable manner. We need everybody to get vaccinated, both so that we can reach herd immunity, but also because these variants are out there. 276 cases now of one of the variants of concern, including 256 of the UK variant. Like we said, vaccine openings everywhere. Jim, if you could put up the vaccine openings site, U of L Health, Cardinal Stadium. Again, tons of appointments available to you. Kroger Field in Lexington at the University of Kentucky, tons of appointments available. St. Elizabeth Training and Education Center in Northern Kentucky is ready for you. Pikeville Medical Center and Baptist Health Corbin, all of these have hundreds, if not over 1,000 appointments available. You can sign up right now. And as an example of getting creative, which is what we're having to do, this is going to be exciting. In just a couple of hours, I'm going to be running out to watch Racing Louisville FC's game against the North Carolina Courage. Today's match will not only feature top-notch women's soccer of the highest professional level, it's also going to help us fight our war against COVID-19. The game starts at 6 p.m., but Lexington-based Wild Health is going to be out there today running a pop-up vaccination site from 5 to 8 p.m. You can sign up right now for appointments at kyvax.com, all in one word, kyvax.com. You get to cheer on Racing Louisville FC as they take on the North Carolina Courage while showing some courage of your own by rolling up your sleeve and getting your shot of hope. Here's the best part. I mean, aside from protecting yourself against a deadly virus, not only is the vaccination free, but those who get vaccinated at the pop-up site tonight will get into the game for free. If they already have a ticket, they'll get a voucher for a free game in the future. That's what I call a win-win. This is an incredible effort by the club. This is an incredible effort by the organization. Some of these amazing athletes have been in our ads, especially ads that reach out to younger Kentuckians. And I can't thank them enough for their leadership role. Now, this is the inaugural season for this professional team. Yet look at what they are already doing to be a part of their community and the responsibility they're taking. I am really proud of Louisville FC. I'm really proud of the stadium and everything that they have done. This is going to be the first sporting event with fans that I've gone to in 15 months. But I am so excited and I'm so appreciative of what they're doing. Thank you for showing leadership and that you care about us, and we'll be there to root you on. All right, and what is, at least some decently good news. Our cases are down from this last week from the week before. When we look at our chart, what you'll see is what we thought last week, that we have indeed plateaued. And that's a good thing, because we saw a couple weeks where we thought we might be on the incline again, but this week, fewer cases than the week before. So right now we're kind of at, we're going to go up a little or down a little, but we believe we are in the same general area. But better news, our positivity rate went down for the first time in at least 4 weeks. That does suggest, using this leading indicator, that we are still at that plateau. And remember, every single person who gets vaccinated helps make sure this happens or gets us on the decline. While I'd like to see more people vaccinated every week, every person that gets vaccinated makes a big difference. Also seeing generally a plateau, maybe a very slight increase in the inpatient census. That's Kentuckians in the hospital for COVID. The same for the ICU, if you want to show that. Again, generally a plateau, maybe a small increase over that last period of time. And we see more fluctuation of Kentuckians on a ventilator. Hospital capacity still in good shape. This is a real positive sign, and we're one of the only states in this country that never, ever had their hospitals overwhelmed. That is something that we should be really proud of, and it means that there are a lot of Kentuckians that are here with us that otherwise wouldn't have been. In a state that came into this pandemic with high levels of heart disease and lung disease and kidney disease, people would have expected us to be at the top of the per capita mortality, and we are not. We have done better than just about every other state around us and most states in this country. And if you look at where we came in it with our health, I think we ought to be really proud of how we've done. Now, we're not done. We still have more time left before we defeat this pandemic, but this is something that everybody out there should be incredibly proud of. Today's COVID report, 213 new cases of COVID-19. Positivity rate, 3.15%. Kentuckians currently hospitalized for COVID, 414. In the ICU, 108. Currently on a ventilator, 47. Today we do have 11 new deaths. 11 total deaths. They are 4 deaths, what you call new deaths, coming up through our local health departments, and 7 from our audit. The new deaths include 1 April, 2 March, and 1 January death. The first is a 67-year-old woman from Hart County. That's from April 7th. Second is a 92-year-old man from Henry County. That was a January death. A 55-year-old woman from Jefferson County. It's a March death. And a 73-year-old woman from Jefferson County. That's a March death. Our audit deaths are all from November or December, and they include an 82-year-old man from Garrett County, a 71-year-old woman from Greenup County, an 80-year-old woman from Henderson County, 71-year-old man and an 84-year-old man from Jefferson, a 95-year-old woman from Nelson, and a 96-year-old man from Spencer County. Long-term care today, not as good as we have seen it in the past. 5 new residents, 9 new staff. We're going to drill down to see whether these are individuals who are vaccinated or not. 3 new deaths to add. Now these were 2 from our audit and 1 from our new deaths. So again, we've liked seeing 0 there. I think we'll see a lot more zeros. Vaccines work. It's been proven here. And even with these are some of the best numbers in a long time. These are the type of numbers that we prayed for. All right, big change for today is we are making a change in our masking executive order. So in July, I signed an executive order requiring Kentuckians to wear facial coverings in public to slow the spread of COVID and to protect one another. It worked. It worked. It has significantly decreased our cases. It has decreased our deaths. But where we are now is having significantly more Kentuckians vaccinated and having seen more data that is out there. Now, let's be clear. You still need to wear a mask, and you'll still be required under the executive order when you are inside any facility with people that are outside of your family. So you'll still need to wear one at work. You'll still need to wear one at the grocery store. You'll still need to wear one at the drugstore. But starting tomorrow, the mask mandate is no longer in effect for Kentuckians that are outdoors at events of 1,000 people or less. It still is in effect for events greater than 1,000. So what this means is things like the soccer game tonight, you still have to wear a mask because there are so many people together. Things like the Kentucky Derby, you still have to wear a mask. I spoke to the CEO of the Kentucky Derby of Churchill Downs today. We agree that with the number of people that their masking rules must continue. They are committed to it and committed to doing it safely. But based on both where we are on vaccinations and what we have seen in recent data, it means if you are at a backyard barbecue, if you're at your community pool, if you are at an outdoor wedding, especially if you are vaccinated, you are not required to wear a mask. Now, if you are not vaccinated and you are at an event where people are less than 6 feet apart outside, we recommend you wear a mask. Actually, we recommend you get vaccinated. But that will be a decision for your own safety in that outdoor environment. But what we think where we are now is especially those that are vaccinated are really safe outside as long as the group isn't over 1,000 people and creates that extra density. We hope that this is a relief. I can tell my son's baseball team, whose parents have been wearing masks religiously at each and every one of those games, that we've reached the point now where we have enough people vaccinated where they can take them off, given that we've never had 50 fans, much less 1,000. So if you're standing on the sidelines of a soccer game, again, if you're comfortable, especially if you're vaccinated, at this point, we're no longer requiring wearing a mask at those points. So with that, I'm going to ask Dr. Stack to come up. He has an update on Johnson & Johnson and our state's resumption of using that vaccine.
Thank you, Governor Beshear. Good afternoon, everyone. It's nice to be here. So, as I'm sure everyone's aware, the Food and Drug Administration and the CDC directors gave guidance this past Friday and said that resumption of usage of J&J may now take place. I do want to give a little bit of background on this and some guidance just to the vaccine sites across the state. First of all, for the vaccination sites, you are allowed right away to be able to use J&J for anyone 18 and older, as described in the FDA's emergency use authorization. So you can go ahead and use inventory you have on hand right away. The FDA and CDC will give additional guidance tomorrow, and I think they're going to have a clinician call in the afternoon. So some of your sites may choose to wait for that guidance and then use that to help with additional informed consent with individuals who seek vaccination with the J&J vaccine, but you are allowed to use it immediately, and there is plenty of information already out about what FDA and CDC have said, so that would be a reasonable course of action if you've already updated your own consent documents. The shipments into the state of more J&J are not likely to resume until the beginning of next week, which would be about May 3rd, just because the federal systems have to lift the ordering restrictions and allow us to have access to it. And shipments only come in Monday through Thursday, so it'll be next Monday will be the first new shipments of J&J into the state. I think it's important that you hear that we have also looked at the information that the federal experts have reviewed, and we followed their deliberations, and for you to hear that we have confidence in this vaccine. And so I want to give a little perspective on this. Ultimately, 15 cases were identified of a condition they call a TTS, thrombosis thrombocytopenia syndrome. All 15 cases occurred in women between the ages of 18 to 59, and 13 of the cases actually occurred in women who were under the age of 50. There was no association found with birth control pills or any other sort of medications. There was not a clear pattern other than the gender association and relative youth of the individuals. The benefits of the vaccine were these. They have found so far in immunizing about 8 million people with J&J that it is 85% effective in preventing severe COVID-19, and it is 93% effective in preventing hospitalization. That is incredibly effective. And so both the manufacturer, Johnson & Johnson, and also the CDC's Advisory Committee on Immunization Practices did their own analyses to put in context what the impact of these vaccines would be. They found, the J&J analysis found that for every 1 million persons vaccinated, there would be 2 cases of this TTS syndrome, but it would prevent 2,000 deaths from COVID-19, and it would prevent 6,000 hospitalizations. So again, there are risks in all the choices we make in life, but there is no doubt that the risk of not being vaccinated is orders of magnitude greater than being vaccinated. The ACIP analysis, the CDC's Advisory Committee analysis, showed that for every 9.8 million, essentially every 10 million people vaccinated, there would be 26 cases of TTS in women who are 18 or older, but it would prevent 1,434 deaths and prevent 2,236 admissions to the hospital ICU. Again, both analyses from 2 different methodologies showed that getting vaccinated dramatically increases your risk of death and severe illness and very minimally raises your risk of having a problem with the vaccine. Nothing in life is without risk, but there is no doubt that the relative balancing of the risks and the benefits show this vaccine to be incredibly effective and incredibly safe, although obviously not 100%. My recommendation to all Kentuckians continues to be get vaccinated as soon as you are able to. There is plenty of vaccine available out there across the state. For the population of women who are under 50, that is the one age category and gender combination where if you have any concerns, even though the risk is almost diminishingly small with the vaccine, there are 2 other exceptional vaccines out there. Get Moderna, get Pfizer. For all other persons, at the moment, there is no significant indication that you're undertaking any meaningful risk by getting vaccinated, but there is an enormous mountain of evidence that you are keeping yourself much safer. I would just say in closing, we have a chance to put this horrible pandemic behind us. In India today, as I stand here, there are well over 350,000 new cases every day. The number of deaths accruing in India are so many that no one knows how many people are dying in India from COVID, and they have to use satellite imagery to look at crematoriums to estimate how many people may be dying. This is a deadly disease. I know when I look out the window on this beautiful day here at the Capitol, that it's easy to believe that there is not a danger out there, but there is. And in the United States of America, we have this great blessing and good fortune to have access to vaccines that virtually every other nation on the planet craves and does not have access to. So I hope individuals will exercise their free choice to take advantage of the exceptional science and the exceptional resources that we are blessed to have in this country to keep yourself, your loved ones, and our communities and businesses safe and open for activity. This summer has a real chance to be normal like we used to know it if we all just step up and get our vaccine as soon as we have the chance. Thank you very much, and thank you, Governor.
All right, we will open it up for questions. I think I have 2 separate listings here of reporters. I will think this is the most recent one. We will start with Tom Letek from Kentucky Today.
Thank you, Governor, and good afternoon, sir. President Biden's supposed to be making an announcement about masks tomorrow. Do you have any insight as to what he's going to say, or is it similar to what you just announced?
We don't know exactly what he's going to say. Certainly, some of the news reports believe it's about CDC recommendations for audio. Many of us believe it is about CDC recommendations for mask wearing while outside, especially for those who have been vaccinated. I don't have any confirmation of that. I'm just reading online what everybody else says. Sarah Ladd from the Courier-Journal.
Yes, thank you. So will J&J resume in prisons, or will there be another option for inmates? And I also wanted to see if Dr. Stack had a chance to review this new MIT study that challenges the effectiveness of 6-foot distancing guidelines, and see if that would change anything in Kentucky's approach. Thanks.
He has not had an opportunity to review that yet. Yes. And prisons will resume with J&J to the extent we have any significant part of the population that is concerned about using that vaccine. We have plenty of the other ones, and we'll make sure they get that opportunity. Again, we had a very large percentage of incarcerated Kentuckians, or those incarcerated in our institutions, take us up on the vaccine the first time around. I believe the last 2 prisons that we need to get them to are both men's facilities. And so I'm not sure there's been any appreciable risk from the J&J vaccine that would apply to those individuals. But certainly if anybody has an issue with it, we'll talk through it and try to make another one available. Shelby Smithson from WKYT.
Hi, Governor. Since the 2.5 million people vaccinated goal was set, numbers have not been tracking on pace to hit that 4 to 6 weeks timeline. They're tracking more toward the end of June. So if that's the case, will you consider loosening other restrictions like on capacity and on businesses like curfews before that number is hit?
We'll certainly consider it. Today we loosened the masking requirement for certain instances. And we'll look as we move forward. Certainly it gets safer the more people that are vaccinated. And also we're being updated by the CDC, by new data and new studies, and we will take all of those into account. What it will probably mean is we will do things more incrementally than as we'd hoped, which is to race there and to be able to do it all at once. But folks, the 2.5 million isn't about just setting a number and then everything changes. It's about making us safe. It's about having enough Kentuckians that have the vaccine so they can be safe, and those that haven't yet been vaccinated can hopefully be safe in some of those same environments. But the more we learn about transmissibility, if you have had the vaccine, the more we learn about how protected you may be from getting it once you have the vaccine. That could certainly change our timeline, and we are going to be open to it. Now, still, go get your vaccine, everybody. Go get your vaccine. It is safe. It is efficient. It keeps you from getting it. The UK variant is out there. It's making younger people sick. This is the way that we defeat, this is the way that we win the most difficult, costly, deadliest war, certainly, I think, of this century or going back through the last century. Please go out and get your vaccine. Catherine Collins from WLEX.
Hi, Governor. What is your reaction to the announcement from the Department of Justice today on the investigation into LMPD? And do you think there are systemic issues within the police department?
Well, today I have talked to the Department of Justice team that will be conducting the investigation. I have talked to, I think it's Associate Attorney General Gupta. I appreciated that call. I've spoken to Mayor Fisher, and my reaction is that policing is an almost sacred responsibility where we convey such power and authority on individuals to keep us safe. That means that with that power and authority, those individuals need to be making right and just decisions all the time. And because of that level of authority that we convey, we always need to be open about ensuring that we are doing things right. And in this instance, that we are ultimately building the confidence in every part of our population and treating everybody the same and ensuring that everybody's civil rights are upheld. So just like the mayor, who has pledged his full cooperation to the extent anything is asked of the state, we will fully cooperate as well. Now, having an in-depth look, and that's what's going to happen here, can only be helpful. Helpful that we build the best police and law enforcement units across the Commonwealth that are possible. It gives us the opportunity to create some of the very best in the country. Certainly at the state level, we're taking active steps. There have rightfully been things pointed out about training materials or some other issues that have arisen, a lack of diversity. And we're not only admitting those are issues, which is the first part of it, acknowledgement, but we are taking active steps to make change. Our new recruiting division in the Kentucky State Police, which is diverse in and of itself, is already paying dividends. Our in-depth dive into training materials, after we saw some things that were not appropriate, are going to make us better, and inviting the community in is going to make us better. We got to acknowledge when we have such a sacred responsibility that we've got to welcome scrutiny, and we've got to make sure that we use it in a way to get better and to do better. Now, I have been assured that this is going to be an independent, fair, thorough, and transparent investigation, that the group is going to be meeting not just with the community, but with individual officers and leadership, that everybody's voices are going to be heard. So we'll be following this, but again, as long as we have the right attitude about it, I think it can make us better, and that's important. Melissa Patrick, Kentucky Health News.
Hi, Governor. So you said last week that you were going to talk to a large number of businesses about vaccines. And I'm just curious about how many businesses were on that call, how many employees they represented. Can you name a few of them? What was the message? What was the feedback? And were they willing to do what you asked them to do?
So last week I talked with the Kentucky Chamber I believe we had 100 plus businesses, a lot of their executive committee too, which are some of Kentucky's largest businesses. And my message was, we need your help. We need your leadership. We need you to be creative. We need you to incentivize. We need you to do everything you can to get not just your employees vaccinated, but to encourage others out there in the community. And we've already seen some incredible response. One hospital system created a bonus competition where the facilities that reached the highest levels of vaccination first got a certain level of bonuses, and next got another level, and so forth. Certainly since that call, tonight's event with Louisville FC Racing has happened, and we are hearing about a number of other opportunities. You know, we also had a call last week with mayors and county judges, and we saw a lot of offers of specific areas and community events where we could do this. I think we got a lot of people out there who want to be creative, who have bought in, and certainly our business community knows about the disruption that a COVID outbreak could cause in their workplace, and that if we truly want to get back to a normal, not just in our personal lives, but in a steady workforce, that vaccinations are the keys. Employees that these groups would have had, I think would be in the hundreds of thousands, especially when you look at the manufacturing, healthcare, and others that were on the line. But again, Melissa, we're to the point where we got to hit the singles and doubles. And whether tonight we vaccinate 50, 100 people, 200 people, we've got to do it over and over. And we got to adjust our expectations for what we're going to get each and every week, and knowing that every step forward is closer to immunity and to defeating this virus. It's easy to get a little frustrated or a little down when your numbers start to dip, but we always knew we'd get to the harder part. We just got to be committed to pushing through. Karen Czar, WUKY.
Good afternoon, Governor. Good afternoon, Virginia. The change in the mask mandate for outdoors, will that affect K through 12 in any way? And in particular, things like recess, if they're socially distanced, or classes outside? And here in Lexington, we have several performances for theaters that are happening outdoors this weekend. Do those performers need to wear a mask if they're socially distanced? Thank you so much.
Well, from the second piece on the performances, as long as it's a performance for fewer than 1,000 people, again, we believe that that's pretty safe, especially if the individual is vaccinated, and know those performers would not have to wear a mask for that. Please, though, tell them to get vaccinated. Hopefully they are already vaccinated. K through 12, that'll have to be something that's discussed with the Kentucky Department of Education. It might be applicable on recess, but remember, our kids don't have the opportunity to be vaccinated until they are of a certain age. We're seeing right now in some public school systems a significant number of individuals that are quarantined. So I think we ought to be really careful there, just given the amount of interactions and separate interactions that occur every day. I think we've got a good set of rules in our schools. I think we're back in most places 5 days a week. We've really got about a month and change to go. I don't think we ought to be cavalier in increasing exposure there. Corinne Boyer from WEKU.
Hi, Governor. Are there any specific numbers showing how many people have been getting vaccinated at mass vaccination sites? And as those vaccination rates are slowing down, will these sites begin closing anytime soon?
So I don't have the direct numbers of what the vaccination sites are getting, but most of them are doing 30% if we're lucky, 40% of what they used to do. And yes, most of them will be shutting down, and we are pushing those doses out into the community. So we'll have every Kroger, every Walmart, every Walgreens. We hope every independent pharmacy. We're working with their distributors on that. Every CVS, every qualified community health center that the federal government is working on. Our goal now is to get it everywhere in your daily lives. I had a individual tell me that they were out shopping this weekend and they heard 5 separate announcements about, if you haven't gotten your vaccine, we got them for you. Come on over and get it. And they said they saw a good line of people that were willing to get it while they were there. So Corinne, that's where we got to get to now, that for the vaccine, kind of indifferent, casual, if it's easy for me, we got to make it easy for them while we continue to encourage. And with our last question, Stephanie Wolf from WFPL.
Thanks, Governor. So in speaking about your proclamation from earlier today, you mentioned this atmosphere of reflection and participation. So it being Derby week, there are renewed conversations about my old Kentucky home and whether it should be sung at the Derby at all and whether it should be retired as the state song. What do you think about that? And is it time for Kentucky to get a new state song?
Well, I haven't specifically heard those concerns personally from community leaders, and it's something that I'd want to make sure I do first, to listen and to try to hear. I think this is a conversation. It's always right to have these conversations, but it's one that's going to take a little longer than the next week. But when people are hurt by something, whether it's this or others, I think it's incumbent on us to say, please tell me why, let me listen, and let me try to hear. Certainly, I think it'll be played this year, but again, I want to make sure that we are always listening to those concerns. I know I had a couple of written questions that appear to be buried in here. I believe there were just a couple from one news organization. If that's the case, we can get them to you in writing. We covered a lot today, which got them a bit lost in my notes. Everybody get vaccinated. And given this is Derby week and you've been doing a good job, this is going to be our only live update of the week. We will have video. We will have other means of communication for the rest of the week, being back next week on Monday, and we believe Thursday. Take care of yourselves. Be safe. Get vaccinated. We are so close to winning. Thank you.